we have Tanya Kale here with us, who is the Vice President of Community Impact 211 and Basic Needs, here to talk to us about United Way.
Thank you for the opportunity to speak to you all tonight. I wanted to start just by saying how much I appreciate your staff and how closely we have worked with them for so many years. You have a tremendous staff team, and thank you all tonight. I wanted to start just by saying how much I appreciate your staff and how closely we have worked with them for so many years. You have a tremendous staff team, and thank you all tonight.
Your recommendation.
Start just by saying how much I appreciate your staff and how closely we have worked with them for so many years. You have a tremendous staff team, and thank you all tonight.
Your recommendation.
Oh, it's fine.
We'll give it a try again. So I always like to just start with the basics. 211 is a free confidential helpline. We're available 24/7, 365 to help people find resources in the community. And of course, one of the benefits is it's very easy to remember 211. So there's 3 ways you can access our service. You can dial 211 from your phone. You can search 211summit.org, and you can text the zip code to 89811. I have a short video we're going to play that just get the video. Okay. Well, we won't be able to do the video today. So one of the things that we're very excited about is Ohio is actually one of the last states across the country to obtain 211 coverage statewide. And that just happened this June 30th. We launched in the last county in Ohio. So this has been an effort for many, many years, and we're very excited that this service is now available across the whole state. You can see in our region, Stark County is one of the closest counties that haven't had 211 service for the past 3 years. This partnership's been made possible with support from the Ohio Department of Children and Youth, and we're hoping that that can continue and grow so that 211 can become even more integrated into state and local government programs. All of the yellow areas are the counties that, that 211 just recently expanded to. So some of the key benefits of 211 and why it's helpful is for anyone who's had to access social services, it's incredibly complicated. There are so many different organizations providing many different services. They're constantly changing, and you might not even know how to call what you need to fit the way it's called in the system, kind of. And so that's really one of the main reasons that 211 exists, is to get people out to all the amazing services like those you offer at the health department and the many others that are offered throughout the community. Especially at times of any kind of disaster. I mean, the pandemic was a great example. There was such rapid changes in what was available. We were constantly making those updates and able to refer people to things that hadn't existed 2 weeks before, or things that existed had closed, or the way they were providing them had changed. So that's especially a time that's really important for 211. You can see there on the right the scope of our database just for Summit County. So we have approximately 800 agencies and 7,000 services just for Summit County residents alone. And 211 is also often an intake point for certain services. So here in Summit County in particular, we've really integrated the homeless service delivery system in 211. So you can call 211 and reach those dedicated staff that are doing intakes for individuals who are homeless. But even though many, many people do calls for basic needs, the thing I'm always trying to get the word out about is 211 is not just for basic needs. I guarantee you, across every one of you and my life, there are people in our families, our neighborhoods, our churches, our workplaces who could benefit from 211, and they may not know it exists. And so I love speaking with groups who may not be as aware of 211 so that they can share it with those they know. What I try to do here is identify some of the services that are not related to income that can affect any of us. Hopefully many of them don't, but they might affect us in the course of our life. I can guarantee you that probably all of us will either get old ourselves or know someone who's getting older. And as you get older, sometimes your needs change, and you might need a little bit of help living in your home to stay there, or you might have a family member who's diagnosed with cancer and needs a little extra support. There's just lots and lots of different things in our database that extend beyond income-based services. We also really like to promote that, you know, if you've got things you need to donate or you want to volunteer, you know, 211 also has that kind of information. So we're really proud that 211 has done a longstanding service here in Summit County, and it is very widely used. It's used by every part of the county, every zip code, every community. We have people that use 211. There on the right side, you can see some of the basic demographics about who calls 211. So we do tend to be more heavily used by women. They're often looking for services for their family. At 3 in 4 people that contact us are women. We also serve a lot of older adults and a lot of families with children in the home. So really that wide gamut of all different types of needs in the community. And that this chart now shows you the different reasons that people called 211 in 2025. And so the 3 top categories for as long, I've been doing this for about 21 years, and the 3 top categories have always been food, housing, and utilities. Those are the basic needs that really, you know, motivate people to seek services. But there are many, many other services that we also have in our database that extend beyond those. Things like free tax preparation assistance is a big thing we get calls about. We do a lot of referrals for all kinds of things related to children, whether it's school supplies or summer programming, after school programming, lots of things like that. And then one of the things we do at 211 is we also track unmet needs. And so unmet needs are where someone is seeking a service and there's no service available for them. There may not be a service at all, or there may not be a service that they're eligible for, because some services have, you know, very strict eligibility requirements. So we've been sounding the bell that housing is that top need. I know that that's come out in your community health assessment too, as a high need, followed by utility assistance. Those 2 areas have really been growing as needs. I would say, especially since the end of the pandemic and the end of some of the assistance that was available there, there's just really limited assistance in those areas right now. Some of the other areas, you know, you can see this a little bit in every category, but that's definitely the biggest too. So we do want this data to be used by the community. We love for it to be used by elected officials and cities and nonprofit organizations. And so we have actually 2 different versions of data dashboards that are available to the public. There is a brand new statewide data dashboard, and that's something that happened with the 211 expansion, and that's the top URL. And then the bottom one is for Summit County, Summit, Medina, and Portage, and has a little bit more detail for our local service area. And we really encourage this to be used, you know, to be used in conjunction with other projects that we're doing. We also maintain an online resource database, and we have very heavy utilization of our online search. We're also really happy that we partner with different organizations to help meet their needs. So one of the projects I did with Shalita several years ago was on creating a category called Healthy Babies that really helps put all those maternal and child health resources in one spot for people. And we've continued to maintain that, and that's just an example of one listing for immunizations in our database. We actually do a lot of collaboration with Summit County Public Health and just wanted to share a few of those. I think the first thing is when we've always at 211 addressed social determinants of health. That's kind of the basis of the existence of the program. And so two of the partnerships that we have that are funded through some contracts with Summit County Public Health are related to infant vitality work and then also reducing youth homelessness. We already mentioned the search category, and we've actually been, for several years now, working to identify people who are calling 211 not because they're expecting parents, but they're just calling for other things, but to identify individuals who are expecting early so that we can refer them into the Neighborhood Navigator program here at the Public Health Department and try to get services rolling sooner than they might be seeking services for their pregnancy. We also provide a link to an API feed to our resource database to your team to create the asset map, and that's just one little map I pulled from the asset map that's available on your website using part of our database. And then, of course, involved in the community health assessment, we also helped push out the survey last year to get more diverse responses to it when that was happening. And then definitely involved in some of the committees that your team is also involved in on disaster response, and especially trying to get the word out to people about resources when there is any type of disaster. So this is just in summary, kind of the three main reasons 211 is important. It is that entry point to services. Instead of remembering everything, you can just remember to call 211. Our resource database, we really try to help support all the efforts in the community with that, and then we have that data on community needs. So thank you so much for the opportunity to present to you today, and happy to answer any questions.
Do we still have those little fold-out cards that had a lot of community services? It was handed out some years ago.
3 cards?
I think that's
We do have some.
the 211 listed in that.
I believe so, yes.
And I'm just wondering if that's something we could get a quantity of. See some of the people who are homeless, going through addiction services in the county, but not really connected to the county. I wonder if some of us could get
Look into
some
that.
extra cards.
Yep, certainly.
Thank you.
And I did also leave some of the small cards. You're welcome to take us back if those to be of use to you, and if you ever want more, just reach out.
You have something that's more pocket size or wallet size?
I do have like a business card size too, not with me, but I'd be happy to follow up with you. Any other questions?
Thank you.
Okay, thank you.
All right. We will call the meeting to order at 5:14 p.m. Can I have a board member roll call vote to establish quorum, please?
Dr. Blakesley?
Here.
Chafin?
Here.
Cook? Here. Dr. DePompe? Here. Mr. Gano?
Here.
Ms. Disperger?
Here.
Ms. Hayes? Mr. Karan?
Here.
Ms. Colner? Here. Mr. Lowry?
Here.
McGuire?
Here.
Dr. Ramones?
Here.
Indirect?
Here.
Mr. Snell?
Here.
Mr. Somerville?
Here.
Dr. Varian?
Here.
Williams is absent. Thank you.
Okay, thank you. Can I have a motion and second to conduct business by voice vote unless a roll call vote is specifically required by our bylaws, state law, or is requested by a member of the board? Roll call vote, please.
Dr. Blakesley?
Yes.
Chief Chafin?
Yes.
Dr. Cook?
Yes.
Dr. DePompe?
Yes.
Mr. Gano?
Yes.
Ms. Gendisberger?
Yes.
Mr. Karan?
Yes.
Ms. Colner?
Yes.
Mr. Lowry? Mr. McGuire?
Affirmative.
Dr. Ramones?
Yes.
Mr. Sundarak?
Yes.
Mr. Snell?
Yes.
Mr. Somerville?
Yes.
Dr. Varian? Thank you.
Thank you. All right, we'll move on to approval of the minutes. Can I have a motion and a second to approve the Board of Health meeting minutes from July 9th, 2026, please? Any discussion? All those in favor?
Aye.
Any opposed? Any abstentions? Okay, so moved. Are there any public or staff comments? Okay. There are no late filings this meeting. Can I have a motion and a second to adopt resolution number 023-26 entitled Approval of the Consent Agenda, Schedules, and All Matters of the Consent Agenda?
Second.
Okay, any discussion?
I do have to state, I'm sorry.
That's okay, I was waiting for
I
you.
was thinking, I was writing and not thinking. So we did have a late update we made to the general fund, resolution. That's the transfer, for our mid-year. We just had to adjust some numbers that were transposed, in my error. So we made a late adjustment today to that resolution. It did not change the total amount of either line item.
Thank you. Any other discussion or questions? Okay, all those in favor?
Aye.
Any opposed? Any abstentions? Okay, motion passes. I do need, last month's Schedule A included a retirement announcement that was effective at the end of this month. Considering that, I would like to request the following. Can I have a motion and second to give a resolution of appreciation to Tawanda Weems, who was the business coordinator and registrar for over 33 years of public health service?
Second.
All right, any discussion? All those in favor?
Aye.
Any opposed? Any abstentions? All right, so moved. Committee report. Dr. Blakesley, Community Health and Wellness.
Hi, yeah, we met at the end of our last board meeting, and while our agenda was thin, it sort of shifted to discussing the purpose of committee and make sure we're meeting our stated goals. As we had that discussion, we talked about meeting frequency. We do need for the function of our committee to meet at least annually, but it would seem that meeting twice a year could be reasonable to accomplish everything. We got input from the different leaders and all the members, and they just kind of shared that goal together, but no specific recommendations.
Okay. Any questions or further discussion? All right. We don't have financial operations, governance, or human resources report, so strategic planning. Dr. Puck?
Hey, thank you. So we had our meeting last month, and Mr. Snell, can you come off of mute? I want you to contribute. We basically had a wonderful meeting. Literally, our commissioner put together beautiful notes, but I'm not even going to follow them because it was so wonderful. We sat there and we heard from 5 or 6 different divisions about the strategic planning. And for those of you that have been involved with strategic planning, you start out kind of like overall, and then you start drilling deeper and deeper into the goals and objectives. And I think all of us, I probably can speak for all of us that were there, we were blown away by the reports that the division heads gave us. So we talked about everything. We have some priority areas, and I will go over those, but I don't want to even go into the detail because I would invite everyone to come to the strategic planning meeting. Is that okay?
Sure.
It was so amazing. Seriously, Jeff, don't you agree?
I agree. It was very good. Everyone gave us a lot of detail, and it was helpful to see that detail. I don't think strategic planning has done a lot of that, and it was a good opportunity to do it.
Thank you. So we're addressing public health hazards to protect the community, strengthen community conditions, access to care, and health equity, modernizing public health practices through quality improvement data, innovation and interoperability, foster employee engagement, development, and performance, develop and advocate for evidence-based policy, practices, and programming, and strengthen financial sustainability and fiscal stewardship. But I will tell you, it was so much more than that. It was these beautiful presentations. And was anyone here that presented? Can you raise your hand? Any of the division leaders here? Oh, that was wonderful. I took notes. I left them on the camper, so it's out west. But anyway, it was really, really good. I don't know. Chris, do you want to say anything else about that?
Yeah, a lot of work and investment has gone into that. That document will be moving to our publisher soon, and we hope to present that, I believe, in October, I believe is our traditional timeline. So we'll have the full report generated for a brief in October.
And we're actually ahead of schedule. If any of you have ever sat on a strategic planning committee before, usually you have like these timelines, and this team is just awesome. I would definitely invite you to participate, just to hear the updates in detail. Thank you.
Thank you.
Thank you. All right, Health Commissioners report.
All right. Good evening, everybody. The Human Resource Committee is scheduled to meet immediately following this meeting. On September 10th, the Human Resource Committee and Governance Committee is scheduled to meet following Board of Health. Summit County Public Health will also be hosting a Township Association meeting. That includes a regular dinner meeting that's conducted usually in September. This meeting is occurring September 1st. All board members are welcome to attend. If you are interested in attending, please email Dawn regarding your attendance by August 21st. We'll be presenting on an overview of the water quality program and an update relevant to regulatory changes associated with septic treatment systems, a local, state, and national update regarding communicable disease topics, an overview of the CHOT and our CHIP process, and also data resources available for local jurisdictions, and we'll conclude with an update from the Health Commissioner. In regards to the program and fiscal updates, July and early August has been a very interesting month, especially in light of the Canadian wildfires, cyclospora, and measles occurring in Northeast Ohio. A quick update on the wildfires. The wildfires prompted Summit County Public Health to issue air quality advisories via social media to support real-time awareness to the changing conditions. The advisories are intended to support informed decision-making as each advisory level has recommendations associated to the equivalent public health risk. We fielded multiple inquiries July 16th and 17th from the public. That includes the public, businesses, and municipalities regarding any planned events that they had occurring. We provided information specific to the advisory levels and the recommendations that are associated with risk to support decision-making. This follows our traditional practice that's practiced by OEPA during air quality events. The news outlets were reporting the required information as distributed by OEPA and NWS. We determined that there was message saturation with our media outlets, hence why we did not send out a release. But the information that we would provide to the media outlets would really be the same that National Weather Service and OEPA provided as well. Dr. Sobolewski will provide a brief regarding cyclospora and measles, so I will refrain from talking about those topics. On August 10th, President Trump signed an executive order pertaining to the childhood vaccine recommendation. This order mirrors the presidential memorandum issued on December 5th, 2025. The order focuses on decreasing childhood vaccine requirements to 11 vaccines. This is a decrease from, I believe, 18. The order also intends to break the measles, mumps, and rubella vaccine into 3 separate single disease shots and administered at separate medical visits. Also in the board report, I included some information regarding the continuing resolution, the fiscal year appropriations for 2027, and also an update on OMB. The continuing resolution is really looking at a stopgap as conversations continue regarding the fiscal year 27 appropriations. That's where most of the congressional conversations have been focused on, is continuing the continuing resolution to support government funding through December. I believe it's the first week of December is what both the House and the Senate versions were targeted. There's still probably a few weeks of discussion once the House and Senate come out of recess to define this resolution. The OMB proposed changes were submitted as a result of the proposed changes to 2 CFR Part 200, represented one of the most heavily commented proposal changes related to federal funding. The overall majority of the comments focused on the potential instability of an award period as requirements, priorities, and interpretations of award conditions can shift. The other most notable comments that were received included the political involvement in the grant review and award selection process. Other comments pertain to increased administrative burden on grant recipients to comply with the enhanced requirements outlined in the proposed changes, and also concerns associated with the ability for funds to be frozen or withdrawn with no defined recourse. It's still unclear at present if the proposals will take effectiveness October 1st, which was their targeted deadline. OMB has a requirement to respond to every comment that was submitted. So we may see a revision associated with those changes. We may see further discussion. They may withdraw the proposal as a whole, but likely this will be a continued topic. That concludes my report unless there's any questions.
All right, thank you.
Yes,
Go ahead.
And I blew up your cell phone.
Yep.
In the past, we have always gotten emails about anything, whatever's for release. And then with the wildfires and then Cyclosporia, we did not get emails. And I'm old fashioned and I was traveling out west. So I don't watch the news stuff. Anyway, I lived it because I have asthma. And so I asked about that and said, hey, I just want to report back to the person who appointed me to this position. And that's how I do it. I forward the email, even though he gets them. He's like, okay, I know you're working. I know you're showing up. But that was just my old thing of doing. So now that we don't do that anymore, I just didn't know when it changed. And I wasn't trying to be snarky.
No, it's
It was just,
you weren't, I didn't take it like that.
it was just literally, I was used to saying, okay, Tom Sheridan, here's the new public health, email.
Announcement, right.
And so the wildfires especially, I mean, those are kind of hard for especially people that had any pulmonary issues or elderly. And I guess I was so spoiled by all the emails that we used to get for that.
Traditionally, we notified via social media, and that's where other updates occurred. We usually notify the board when a press release is issued. And that can be a process adjustment that we can explore, especially for notable incidents such as this. For Cyclospora, I know we've conducted numerous interviews, but we can look at also a process to brief the board on.
Maybe, I mean, honestly, it's just a matter of me doing my job and getting it back to the person. And like I said, I'm not even a TV person, so I don't watch anything. And my phone, when I say, what's the weather today, they tell me I'm in Avon, Ohio. I'm in Medina, Ohio. I'm like, no, I'm not there. So it's not really accurate. And I don't want to pass that stuff on based on the National Weather Service if that's part of my phone's issue. So anyway, just a comment, not a complaint. But hopefully I didn't blow your phone up too much.
You didn't. It was totally fine. Does anybody else have any? So in the past, it was just press releases in which we got notifications from the board. If all of you want more notifications from me, I can certainly, when Chris reaches out to me, I can make sure that I am communicating that via email. How does everyone else feel? Or what are your thoughts?
Talking about the emails that we get periodically with updates.
Yeah, well, this was in particular.
The
Wildfires and Cyclospora. Rather than just going on our website and seeing what the board is doing, would you prefer me to send you an email giving you kind of what's been done and what?
Personal preference. I don't need any more emails.
Okay.
I mean, I think like knowing if cases of Cyclospora have spiked in Summit County, I would be interested in that. So I think if that came your way, I think that would be a good thing for the board members to know that,
Okay.
I think things, for me, it would be more that were point relevant. Again, the air quality specifically in Summit County, if this is affecting us,
But we're talking about communication outside of the typical communication we get just before
Correct.
Need it.
We're actually talking about a change, because we used to
Yeah.
get emails on everything, because I used to just hit forward, doing my job, and I'm glad that the city of Hudson can know, because then it goes on the website that Summit County Public Health has put this out. Everything.
Okay, that's why, because we did more press releases in the past. Now it's more social media. Okay,
Exactly.
so
I don't know if we can just, if
we
you guys
can,
are doing it, social media, just push that to the board?
we could push that to the board.
We could include another checkpoint in our discussions relevant to any media involvement or publishing of data relevant to briefing the board as a whole. So we'll make sure that that's a discussion point that's included.
Okay, good.
That sounds good.
Well, and some of it's gotta be discretion, right? I mean, it's more newsworthy changes, right? Because if-
Yes, I'm not gonna push everything,
You know,
right,
another disease might not be like-
right.
No, but I think the wildfires were worth it.
Right, oh, 100%.
I didn't even know there were wildfires. I got home from being out west, and I had someone come over to do my septic tank, and he goes, "Oh, I smell smoke." I said, "Oh, that's because I had a fire in the fire pit last night." And then I called my husband. He's like, "Oh, no, Kath, there's wildfires." And I was like almost embarrassed. I'm like, man, we should know this if we're not here and we're not listening to the news. And so I wanted to push that through to Hudson so that the residents at least knew that there was wildfires and there was smoke and there's the retardant, the whole 9 yards.
Okay,
And that became quite a conflict. I mean, I know it wasn't necessarily a conflict with Blossom and the concert that was in our city, but
yeah, it's a big one.
that was around kids' baseball games, kids, anything
Right.
happening outdoors, and there wasn't really guidance. You had people making their
Yeah.
own decisions. We knew if we could influence it.
Or at least just give an info. It doesn't have to be a press release, just maybe here's
Yeah.
the info from the National Weather Service, you know, I mean, whatever.
We can add that. We can add that if we're doing something on social media, we can make sure we are notifying everyone
The
on the
impact on
board.
Summit, you know, like the impact on Summit County.
Yeah, impact. Now, we couldn't, what wouldn't happen if, for example, in these wildfires, is we as Summit County, as a board, like Blossom called us, right, and said, what is your recommendation? We are not going to give that recommendation. So it wouldn't be us saying to you, okay, go back and tell all of your people to stay indoors, or don't go outside, or don't go to concerts. We wouldn't do that.
No. But even if you just say, check with National Weather Service, I mean, anything, because a lot of people I know, and I'm older, they don't do social media. They just don't. They don't go to find out what to do about that. So,
I think you can't say, you know, smoke pollution, air pollution is, you know, moderate in Summit County, you know, please be advised.
or the National Weather Service or whatever.
Yeah, I mean, we can follow what the, what the actual recommendations are based on what the number is.
Yeah, but I can't imagine the city of Hudson wasn't on top of this. I mean,
Well, they are, but, I'm not the.
Checking everybody in the community, I mean, and they were dealing with that, you know, on an hourly basis in terms of.
Well, yeah, but what is our responsibility as a board, as a member?
That's our responsibility.
Our responsibility
Knowledge of that.
is to give
I was in
the,
Europe during one. It was definitely.
I'll shut up.
For an air quality, for an air quality incident, we follow informed decision-making. So we issue the advisories that EPA allocates on that airnow.gov. That's the best source of information that we collect. That's through sensors that are located throughout our communities. With the advisories, there are recommendations relevant to the equivalent health risk and ways to mitigate that exposure if there is concern. And we really focus on informed decision-making associated with the risks that are in each advisory level. And that's historically what we have practiced, and most other jurisdictions do as well.
Yeah, so what we could do is send the email out with this. I mean, it's right, actually, Chris did a great job in his health commissioner's report of putting the air quality guide for particle pollution, and we could send that out. We can add that to our process. Yep. All right, fiscal report. You're welcome.
Just an update for everyone, the IRS increased the standard mileage reimbursement rate on July 1st. It went up to 76 cents per mile. That is a 3.5 cent increase. So we went ahead and updated our reimbursement costs to reflect that for staff who travel on business using their personal vehicles. And then also the monthly reports are there. If anyone has any questions, I'd be happy to answer.
Questions? Okay. Environmental health, nothing tonight, right? Didn't want to skip over you, so. All right. Medical director's report, clinical health, Dr. Slabowski.
Okay, quick update on all the things happening in communicable disease-wise. So cyclosporiasis, this is hot off the presses just this afternoon on the ODH website. Total number of cases reported for ODH is a little over 5,000. As you can see, I can't.
Yeah, I can.
So I'm sorry, it's 189, I believe, reported through Summit County right now. However, that's what's on the ODH website. Currently, as of today, we've had 545 positive lab submissions to us. 212 of those are confirmed. 7 have been travel associated when they've been vetted. There's a 12-page interview form that everyone needs to complete when they're positive. So as you can imagine, some people have not completed those, and so we're just with the cases at this point. There also is a very big delay between what is live off the presses here, what's reported at the state level, and then also at the state level. So you'll see those numbers continuing to increase, even though what we're seeing right now is. This graph, I think, shows the best, and this is really from specimen collection date because it's the only consistent number that we have for all the cases that we're looking at. So do keep in mind, some people haven't seen a physician till 3 weeks after they've had symptoms and then had their specimen collected. So we're going to do regardless. The first red line that you see here is when Taylor Farms voluntarily recalled the lettuce. So from that time to the next red line on 8/1 is the 2-week incubation period. So from that time, that was in the last ingestion, where we would see people becoming symptomatic, and as you see after that second red line, cases have just plummeted. We're still seeing some, but again, some people have been sick for a very long time, and so that's what we're seeing as far as the data belongs to that. It's definitely effervescing. I mean, we're consistently seeing 30, 40 cases a day, and now we're getting down to 1.
I also think too, Erica, from our standpoint, when we send it out, they were so overwhelmed with all the testing that they were actually delayed. So we were delayed at least a week plus on some of the labs, getting it back. So that's going to affect those numbers too.
Absolutely. Those are the days that it was at least received in the lab, not the date that it was processed, which again was a significant delay. But again, it's the process of what happened. Many, many, many more people were sick with symptoms. We were not tested. So these numbers are really different.
Do we have any deaths?
We haven't had no deaths. Throughout the state, they are guesstimating with the data that they have now about 5% hospitalization. Of those, most of them are elderly, immunocompromised. So again, sort of a spectrum that you would see. Measles, so this is the updated numbers, 2,465 cases. As you see on the graph, see the numbers starting to increase, and unfortunately, that's because we currently have an outbreak in northeastern Ohio of measles. All of 2026, so the numbers are slightly different. This is from Johns Hopkins, and they vary plus or minus 20 or so, just because of their surveillance techniques. But if you look over the last 2 weeks where the blue dots are, you're seeing that cluster there in Pennsylvania and Ohio. So a little closer look at that. 162 cases of the past 2 weeks. The big circle in Pennsylvania is in Lancaster. There's about 55 cases. When you see the big circle here in Ohio, that's Geauga County, and the second largest is Tuck. So this again, straight from today, 58 cases associated with this current outbreak. So that's beginning July 9th through today. And that's an increase of over 23 just in the last week. So as of total, For 2026, we have 69 cases total, just as of today. In comparison, you can see the year before, in 2020, that was that large outbreak that occurred in Columbus. Take any questions that anyone has.
Do you anticipate it's gonna go up when school starts?
I anticipate that it's gonna continue to increase. I'm not sure how much school is going to have to do with it, with the current, unvaccinated populations that we're dealing with, whether that's going to increase. There were multiple large gatherings, however, which I am sure. Thankfully, nothing in Summit as of yet, but we are prepared. That happens.
Can you comment about the wastewater testing and how that factors in?
Yes, I think there's been some miscommunication from the hospital systems about the wastewater. There's currently no measles detected in the wastewater. It is being tracked through CDC, from the Akron municipal wastewater as well as Portage, and they are not detecting this particular population. I would not see in the municipal wastewater system a spike. So I think that's the big caveat that we have to, there's other systems where, again, septic and other systems where waste goes that are not being tracked as well. But we are watching. Also within this Ohio State wastewater system, we are part of the core group, so there's aesthetically 25 places within the state of Ohio that have routine wastewater testing. Typically, they're only using those for respiratory, so COVID, RSV, flu, but they do have emergency capability when they do see things that they can expand and do targeted wastewater surveillance. So it'll be interesting whether they feel that this is worthy or not to do. Other questions? Or questions from the municipal and Decker? Thank you.
Thank you.
Thank you.
Okay, we do have miscellaneous business, so I need to go into executive session. So I need a motion and a second to adjourn into executive session at 5:43 PM to conference with an attorney for the Board of Health concerning a dispute involving the board that is subject to imminent court action pursuant to ORC 121.22G3.
So moved.
Second.
All right, roll call vote, please.
Dr. Blakely? Nathan?
Yes.
Dr. Cook?
Yes.
Dr. DePompe?
Yes.
Mr. Ganell?
Yes.
Ms. Gendisberger?
Yes.
Mr. Karan?
Yes.
Ms. Colner?
Yes.
Mr. Lowry?
Yes.
McGuire?
Yes.
Dr. Nemonis?
Yes.
Dunderak?
Yes.
Mr. Stout?
Yes.
Mr. Somerville?
Yes.
Dr. Varian?
Thank you.
Would Tanya, Angela, and Eric stay? Thank you.
Okay, let the record reflect that there's been no formal action taken during executive session. And we will adjourn the meeting at 6:05 PM.
Thank you.
Thank you.